Well, technically, if I went to school and became certified, I would be a medical assistant, and a medical assistant does both parts of a medical office. They do the paperwork, accounts payables, receivables, they pay the bills, they post the insurance payments when they come in, they answer phones, do the reception work, and then also help in the back office, sort of like what a nurse might do. Again, taking vital signs, giving shots, doing lab work, and that's, if you like both ends of it, a medical assistant is perfect because there's the secretarial part, and then you also aren't just stuck at a desk all day, you also get the patient contact. Well, my favorite class in high school was a business class where it was simulated in office. So for 2 weeks we came in, and say I was the receptionist for 2 weeks, and then 2 weeks after that I worked in the accounting, the pretend accounting department, and 2 weeks after that I was in human resources. So that was a really fun class in high school because it gave me a taste of a little bit of everything. So that started me out liking the business world. And my grandmother was a nurse at a local hospital, and she lived with us for many years during my childhood, and she introduced me to the healthcare profession. So to me, being a medical assistant is the best of both worlds because you've got the paper and you've got the clinical also. You have to like people, be people friendly, and have compassion and care about people. Whether or not you're just at the reception desk, that's the first place the patient comes to, the first person they see, and you represent the practice, and right there the patient can decide whether they're going to stay or not. So even being a receptionist is a very important role in a medical office. The thing I like most about the job is the being with the patients, face-to-face, hands-on. I do a lot of the clerical parts in the job, but through job training I was taught how to do blood pressures and vital signs and draw blood and do EKGs, and I check patients in from the moment they come in the door to the time that they leave. There's a full circle from checking them in and getting their vital signs, taking their medications list, talking to the doctor why they're here for the appointment, to checking them out and making their next appointment, helping them with tests, scheduling tests, also their billing questions. So it's very complete for me.